The Planning Commission podcast is a spirited discussion with myself and a couple of my longtime colleagues in the profession. Our discussions are based solely on our own opinions and do not reflect the opinions or views of our employers, the American Planning Association, or even our alma maters. So grab a seat in the back of City Hall, dig out an old copy of Robert's Rules, and for goodness sakes, read your packet. The Planning Commission is now in session.
And hello, everybody, and welcome to another episode of the Planning Commission podcast. Man, are we excited. We have a fantastic guest today, an expert, a real-life expert. How about that? And the title of today's episode, America's Sick. Is there a planner in the house? Yes, there are, but we're going to need a lot more of them to get to the issues that we're going to address today. So, my fellow commissioners, welcome. It's been a little bit since we've gotten together. Let's set the table a little bit here. I want to ask you a question. What is it that defines a healthy environment to you? This is certainly a pool that I know that we've all kind of swam in the last few years. So you tell me, what are the characteristics that define a healthy environment in your mind? Don, what do you think?
Yeah, Chris, I think waking up this morning to a apocalyptic red sunrise because of the wildfire smoke here in Boise got me to thinking about that topic, because it's not a healthy environment out there. And, you know, a biggest fear for me long term, especially in a place like Boise, is, are we going to have regular summers where it isn't smoky? And I think the subject matter we're talking about today is related to a lot of the things as to why we have wildfire smoke out there today. So going back to maybe the fundamental thing, I think it's a healthy place for what we talk about in our work with the 7 dimensions of health and wellness, and getting away from that physical health piece. Not that it's not important, but how mental, social, environmental, intellectual, spiritual health, all of those come into play. And when we think of a place that embodies that, I think it has positive attributes of all of those things.
Yeah. And I think maybe we'll dig into that 7 dimensions model a little bit more in a bit, because as much as you and I, and maybe some have been working in that realm, it's still seemingly new, right? It's still a topic that not every planner or engineer is kind of like, what are you talking about? And man, it's probably one of the favorite concepts that we really think about and use. I think it's such an informative way to do planning, really. But come back to that in just a minute. Jess, first of all, thank you for joining us, Commissioner Smith. We know that you're under the weather. You're going to soldier on. We appreciate it. So what do you think? Yep. What do you think of a healthy environment?
Right. That healthy environment. I want to continue what Don was saying, and that mental health in your environment, and like what that baseline looks like. So much of being a remote worker, like I've been for the last year and a half, and those items I didn't understand for a little bit. It sounded great to begin with, and then it was this lack of connection back to my community. And that speaks to that mental health element that we have in our communities, and how important it is for us to connect with others and connect with our community on a deeper level that is meaningful and healthy for us as individuals. So that was something that just really came top of mind for me, Chris. And also thinking about how that mental health, 70% of it, 30% of it, we can talk about things like medication and stuff, but 70% of your mental health is going to come with hydration and getting good sleep and being able to exercise. So those things are very physical to inform our mental health. And so it's coming hand in hand with what we're doing in our communities, and that ability to get out there and breathe good air and walk around or stroll around or roll around, whatever you've got going on. So that's what I think of with healthy environments.
Well, there were 2 things I think that for Chris and I, when we first started integrating the health back into planning and looking at those things, that I know we had 2 situations involving projects that really drove this point home. And one was here in Garden City, Idaho, about probably a decade ago. Chris goes out to do some field work on their green belt along the Boise River, and sees this group getting together to pray
Yeah.
and then walk
Yeah.
along it. And you realize this is something more than just moving your body. And I had one where we were doing something in the Raleigh region, and we were in a pretty well-to-do suburb that had invested in parks and pathways, and kind of, if you were to kind of take everything you learned from a planning conference and throw it in this community, they'd tried it. And we had somebody in their 70s, this man, when we asked, the last thing they did was healthy, and he said he's ridden his bike 7 miles a day for 3 straight days for 21 miles. And I thought, this is a great story of community building and all of this. And I asked him to tell his story. And he just mentioned that because there was one bad road or intersection he couldn't get to the pathways that he wanted to. So he rode 7 miles a day in the truck delivery area behind Home Depot. And went, here's where we're failing at the small stuff, despite a community that had put money in that. So I'll lead that into, Chris's moments and what he thinks, because I know it's been a big driver for him, even going back to before you were in this profession.
Yeah. And, I've thought about this issue, obviously, for the better part of a decade. And man, I tell you what, I think sometimes we get pretty elaborate in how we define a healthy environment, right? We put up dashboards and toolkits and all the things that we've been talking about, right? But I tell you what, the more I've worked in communities, sometimes my bar is very low. And what I mean by that is if you don't feel comfortable enough to say walk to the nearest park, let's say it's a quarter mile, right? To walk your dog. If you got to jump in the car or truck to hop on down to the park to then walk, or if you can't go get a gallon of milk at the corner store, if you can't meet those bare minimum thresholds, then we, the planning profession, I think, are absolutely utterly failing. Like, that's a pretty simple measure. And we get into this whole notion of quality of life too, which is great. Everybody says they want to have a high quality of life. I've yet to see a city that says, we really strive for a marginal quality of life. We're just going to shoot for the bare minimum, but they can't define that. And I think there's a way to define it. So we're going to get into our guest in just a second, because he has way more insightful things to say than we do, and can't wait. But before we do that, real quick, Commissioner K, tell us a little bit about this whiskey pairing that we always do to set the stage for our episode. What do you got for us?
Yeah, I think you were joking for today's guest being a public health professional, academic, CDC. Our whiskey pairing really should be water, I guess.
It should be.
We can't go with that. But I'm going to go with, had to think about this one. I'm going to go with something from one of our favorite places in the Northwest, McMenamins. And I'm getting some interesting.
There you go.
Anyway, it is the Edgefield Distilleries Avalpota apple flavored.
Got a little apple, yeah.
So we've got something from Oregon, which I think most people at least say is a state trying to do better in some of this realm. It's made with fresh pressed apples. So, what could be healthier than that? And then it also has cinnamon in it. And we have hints of apple pie, which is what's more American than apple pie. So that's my pairing for the day from McMenamins Edgefield Distillery, Avalpota apple flavored whiskey.
Oh boy.
Go ahead.
I want to know, when are we going to get into pumpkin spice? Because
we're not. No,
I'm basic. I'm basic.
But real quick, my question is: so if the old adage is an apple a day keeps the doctor away, does a shot of apple whiskey keep a doctor away? I don't know. We'll have to ask. That's right. We're going to have to ask our guest, which it is time to introduce. I am so excited to have Dr. Richard Jackson joining us. This is a man who has been leading the discussion in so many ways nationally with regard to public health in the built environment. He's got just an incredible amount of work under his belt, and he's got more to come. And we're here to talk some about that and his experiences. So, Dr. Jackson, thank you so much for joining us. Welcome to the Planning Commission podcast.
It's a treat to be with you. And I love, and I learned to say it, Boise. It's a wonderful city, and I know you're worried about the infusion of Californians, but I can see why everybody wants to go there. Great to be with you.
Well, yeah, thank you for joining us. We're going to jump right in. And I really want you, for anybody who's listening who might be unfamiliar with you, which gosh, that's a shame if that's the case, but just give us your story, and it's quite a story. Who are you, the man, and what are some of the basic experiences through your life that have brought you to this point?
Wow, I'm in my mid 70s. Be careful what you ask for.
That's okay. Hit us.
I had a pretty vivid childhood. My dad was a fighter pilot, survived the South Pacific, and came back, had 3 little kids. And in 2 days, we were living in Maine, and he was running the airport in Maine, and he developed polio and died in 2 days, leaving my mom a widow. And we moved back to the family home in Newark, New Jersey. And I'm sure that's why I went eventually into pediatrics. It was both the importance of immunization and the importance of child development. But it was also, you suddenly realize that there was a lot more impact than simply illness and death. As Jessica said, it was a big impact on quality of life. The good thing about Newark was it had parks designed by the Olmsted sons, and you could go to the park, and it was the only relief in a very dense downtown. The other good thing, by the way, was I was basically a war baby, but there were many children around, and kids need other kids. And I think when we build places that isolate kids, it impairs their autonomy. I mean, I'm going to say something awful, but one thing I had to learn as a little red-haired kid that had skipped classes in school was you had to stand up to bullies. You had to learn very quickly how the world was run. But I thought, because of how I grew up, we were a very strong Catholic family. I wanted to be a priest, but I only lasted 2 years at that. But I wanted a life of service and went off to medical school. And I will tell you, I was there doing pediatrics at high-end tertiary care center at UC San Francisco, and seeing children of farm workers coming in with really bad birth defects. And I became convinced that there were environmental causes. And growing up in New Jersey, it was the Garden State, supposedly. It was the Garden State 100 years ago. It was the industrial state and chemical state, refining state when I was there. And so I decided I wanted to do environmental health rather than infectious disease stuff, even though polio was a big thing in my growing up. And did that, worked a lot on farm worker health, and went to CDC in 1994. I was recruited to be the head of environmental health, National Center for Environmental Health, which was a lot like being the head of environmental health in the United States of America, because EPA does legal and engineering stuff, but we did the health stuff. That was both a recipe for immense gratification and great joy and great learning, but it was also a recipe for depression. What I mean by that is everything seemed to be going the wrong way. We bought a house in North Atlanta and suddenly realized my kids were all going, and we had 3 boys, and all were going in different directions, each about 5 to 8 miles away. Mm-hmm. My oldest son ran cross country, and there was not a park he could get to walking. There were no sidewalks. His high school didn't have a sidewalk. There's high school within a mile of where they were going. And my wife had a hard job. And I think I tell this story, but it's not atypical for a lot of American families. Mm-hmm. People feel so strung out. And you ask the average young parent, is your life better or worse than your parents' lives? Well, oh yeah, my mom and dad, put it out the door, and we ran around, did our thing, came in when the street lights went on. And suddenly I'm driving my kids everywhere, and this automotive dominated world that we've created. And it's very good for, we pour a lot of concrete, we make a lot of steel, we use a lot of gasoline. It's economically very attractive, but in terms of life, it's almost like a brilliant person sat there and said, how can we make the average American adult miserable? And Jessica talked about depression, and she hit it right there. You want to be healthy, be with people you love, get food that is healthy and good for you, socialize, have a community that you're engaged in, and be physically active. And we've done everything the wrong way. And so to make a long story short, I was doing I was overseeing chemical weapon destruction, cruise ship docking, September 11th activities. We had all the emergency response in my center, childhood lead poisoning, radon, on and on and on. And it suddenly hit me one day in the late 90s that, we're sitting here at the end of the disease pipeline and we're not having enough impact on what is being built, what is being designed, what are the homes like. The average American home is half garage that has human habitation attached to it, and it really was not devoted for people.
So how did you make this pivot from, like, I'm thinking that your chemical weapons, farm workers stuff, I think these are things that I think when most people would think of environmental health are the stuff we've heard about. And I'm guessing you probably had professionals at the time. How did you make this pivot to this specific city, urban built environment piece of that? Was that a challenge for you? Was it a challenge for your colleagues? Was it a challenge for CDC?
Oh, Don, thank you. One is by 1998, I was demanding that the buildings have pleasant and attractive lobbies, that the stairways go up to the upper floors, that the meeting rooms be off those floors. There could be covered walkways between the buildings. I had about 500 staff and about 500 contract staff at the center, and I wanted covered walkways. And the General Services Administration, what do you need that for? It's Atlanta. It's hot and sunny and rainy. And I want people to meet each other. That's why I want to have the meeting rooms off the stairways, because the connection of people is very good for a creative environment. As Jessica said, if we're too isolated, our ideas, well, at least my ideas, get stale. I need to be talking to people I learn a lot from. But I got huge pushback, and I wanted bike racks by the guard station, which seems perfectly obvious, but actually bike racks were anathema in the beginning. We eventually got them, but then they put them off in a corner where things would get stolen. And I wanted it near the guard station. So there were kind of common sense things that right now in the world of public health would be seen as common sense, but they were seen as outrageous. I'll tell you one more quick story, but the city of Atlanta was thinking about cutting down their trees because the trees were viewed as traffic obstructions next to the road. I don't need to explain to your listeners why trees are important.
Yeah. Well, one of the things we do in our walkability training is we show a street here in Boise that's your typical tree line, historic boulevard. It's the iconic place people would take each visitors, and we say we've pretty much made that street illegal today in the name of safety, even though if you looked at the traffic volumes and crashes, its rates would show it's one of the safest. So we get that piece as well. Jess, kind of tying the planning stuff to this, I know you have a question.
I do. So here's what I'm thinking about, Dr. Jackson. You're trying to make change in your built environment where you can. What did you learn about planning once you got into that health and the built environment side and trying to balance those two? What did you learn about planners and planning?
One is I had never given a talk related to planning or architecture before the year 2000. And the big jump off was I began to read a lot. One of my favorite books was A Clearing in the Distance by Witold Rabinsky, the story of Frederick Law Olmsted. And Olmsted was, for me, very inspiring for a lot of reasons. But then began to go deeper and realized that the American Public Health Association, 150 years old this year, had a half dozen what we would call now urban planners or business people, but they thought a lot about how places were designed as a health issue. And a lot of our best parks were put in the late 19th century, early 20th century, because of that belief that people needed green space. Olmsted called parks the lungs of the city. But I'll tell you, the first couple of talks were pretty clunky. I couldn't handle a lot of the questions and people were pushing back at me. And I'll tell you the truth, I ended up like trading on my pediatric background. So I would say, I know what I'm going to tell you what kids need. Kids need increasing autonomy. They need physical activity. They need to be around loved ones and to feel safe, blah, blah, blah. The other thing I learned is when I started to talk to city councils is the council members all wanted to talk about their diabetes. So, it opened the door.
Well, unfortunately now we have to talk about our children's diabetes. So
Yeah.
Well, what do you mean our planning isn't healthy? It says health, safety, and general welfare in our ordinance. Dr. Jackson, why are you giving this speech? Our traffic standards, we follow our traffic standards. It's safe, right? It's like we definitely, I think, know those questions that you got from that. Chris, you're chomping at the bit here.
Yeah, gosh, the stories are already flowing in my mind. And so the fact of the matter is that Dick, since you brought up Frederick Law Olmsted, I'm going to name names here. I went to grad school up in Spokane. Well, the Olmsted folks were brought in years and years and years ago, obviously, and they designed 3 parks, right? One of them is named Liberty Park. Liberty. Yeah. By the way, I've seen a number of Liberty parks around the country where Liberty has then since been grabbed and taken from people. But in that instance, Liberty Park basically doesn't exist anymore. It went from I think it was a 50, 60 acre or something like that, whatever it was. Well, I-90 runs through there now.
Oh no.
And basically that park was just completely obliterated. And it's also socioeconomically speaking, one of the tougher places in Spokane, and so you're hitting the nail on the head. So I'm going to read something from your newest effort that we'll talk about in just a minute to tee up a question that I'd like to ask. So one of the things you wrote in your newest a book that's forthcoming here soon is, by making our goal the improvement of children's health and well-being, and setting aside the turf battles over zoning, planning, and air and water pollution, we could focus on giving our children healthy places, and we can offer solutions that work for future generations. Love it. Love it. I've got 2 little ones, and that's what we're trying to do too. Every single day that we, plans that we work on. So my question to you is, if you could sort of go back in time, 30s, 40s, whenever, right? And make some of the changes that you are now really pushing hard for, what would you think some of those changes might be, so that maybe even some of our previous generations, could have been saved from some of the very ills that you're describing that have occurred over the last several generations? What do you think are some of the most impactful things that we could have done, or maybe even can still do?
I hadn't thought about this answer, but I think community activism, particularly by empowered people that have lived there, have ground truth, who know what's going on, and the wisdom of that. I'm sure most of your listeners have visited San Francisco, and if you visited this place 20 years ago, there was an elevated freeway that was abandoned after the earthquake, and that was stopped because the Baby Carriage Brigade, the women of San Francisco, said, "You're ruining our city. We want to be able to access the Embarcadero and the bay." And it's a lovely part of town. When I was in med school there, and we're young men in med school, we didn't want to go down to the docks, that area, because it was pretty scary, and it always end up in a fight, or it was dangerous. And that eventually, the earthquake was a gift in the sense that it had to be taken down, and the beautiful Embarcadero was put in. And now it's a center of life and bringing your children and grandchildren. They love walking along there. The other activism story that you don't know, and it breaks my heart, the Spokane story, because the city of Atlanta, the Department of Transportation back in the 60s wanted to run, I think it was Highway 20, straight through Druid Hills Park. And it was just Olmsted Park, beautiful trees, the whole thing. And a community campaign, and I'm going to brag about guys that were, and it was mainly guys, doctors back at CDC in the 1960s, help convene and lead that whole group. But it was also the garden clubs and women speaking up as well. And Atlanta had a very strong set of garden clubs, partly because most of the men were getting rich at Coca-Cola. And so I think the activism from community counts for a huge amount. And something you probably don't know, because I've done many cancer clusters and birth defect clusters and environmental spills into drinking water, and you name it. It's always, I'm not exaggerating, it's always the women, and you do not want to get in the way of a pissed off mother with a sick child. And
you do not.
They are very, God bless you all, the women that are listening here, because community activism is all important, because nobody cares about kids unless they're getting pounded on it. They say they do, but they don't really.
Well, I mean,
Okay,
here's a piece
the
of
elected
that.
officials. Sorry,
I
Don.
mean, no, it's fine. I mean, how can we piss off the moms with the things we know today about kids that grow up next to busy highways have asthma and COPD rates as if they grew up in a secondhand smoke household? That's the thing I think we're looking for to get at that. And I'll go back to a question here, kind of Chris led it, and I talked about the, every zoning ordinance in this country says it shall be for health, safety, and general welfare. But I would contend that we're still defining health as we defined it 120 years ago. And for the most part, the things that were killing us as a result of that stuff, and water and sanitary sewer conditions and overcrowding and lack of ventilation, I would say in many cases, zoning and related regulations, we've kind of done that, right? Job well done. But we've not modernized our thinking in terms of health for that. So if you could go back and change the way we look at something like zoning or built environment policy and kind of bang some people on the head in the 30s, 40s, and 50s, what one thing would you change at generations down the road today we would be better off?
Don, people took it for granted when they got out of the squalid, dense cities with the tenements, and they were making more money. And this is really the beginning of American Public Health Association that, and you all know some of the towns that were built on light rail lines had a town center. It had a lot of amenities that people needed. The park with the band shell, the baseball park in the downtown area. So we kind of thought that, we didn't have to worry about health anymore because we had this car and we didn't have to be in squalid urban areas. And then we developed our own kind of 21st century squalor that is so car dependent. I cannot speak to the form-based code stuff. There are people that know much more than I do. So I'll defer on that, but I am going to speak to something that's very profound in the state that I live in, which is tax policy. Our tax policies, if you leave a house vacant, but you have a Prop 13 tax rate that is minuscule, goes back 50 years, you're paying next to nothing. There's no incentive to put people in there. There's no incentive to pay enough taxes to support the place. And so what happens is some lovely towns faced with redoing the downtown or having an auto mall put in, because auto malls generate a lot of sales tax. So do big box stores. They opt for the big box stores and the auto malls. So I actually think tax policy is extraordinarily important in all of this. But can't really speak to zoning. I hear arguments that it's done more harm than good. I don't know.
I would say it's, I think it's time to modernize our look at public policy for that. We've kind of had zoning in a stagnant stage, and things like form-based codes and even urban growth boundaries haven't caught on widespread. And so I think your point about, here's tax policy, that's one. We know housing policy tied with transportation policy and other things. So that's an interesting one. When we have Joe Minicozy with Urban 3 on here to talk about property tax policy and things, I think we'll hit on that a little bit more. Chris, Jess, questions?
Well, I did my quick follow-up, and I know Jess has some questions she'd like to ask. I just, one of our previous guests actually, talked about zoning in the Bay Area and its history going back 100 years ago in Berkeley, and some of maybe the motives for why zoning was instituted in the Berkeley area and what it was really about, and then ultimately kind of how it has had this legacy of creating a more sprawling, land use pattern, and then it just spreading the country like wildfire. And you talked about, in Atlanta, I know that's probably one of the cities that you could probably argue had seen the most sprawl in many cases, and they're trying to overcome that. So yeah, it's a definitely a complicated topic, of course, but one we'll continue to explore. Jess?
Yeah, thanks for talking about cities and that connectivity with, we were just talking about simple things, sidewalks, transit centers, things like that. And I'm remembering my dad. I grew up in a really small little town, but it had a little downtown. And I remember my dad talking about years ago when he was a kid, you could get on a Greyhound bus and go anywhere in the country from our little downtown. He said, but but now you can't do that anymore. There's no Greyhound bus that go to these small towns. You have to go to a city, you have to get on an airplane, you have to do these other things. And he was like, we didn't feel trapped here because you could go anywhere and you didn't have to have a car. You didn't have to have a real, reliable car that could go across. You didn't have to have hundreds of dollars for an airplane. So, that him remembering being a kid in the 50s and 60s, I was thinking of that when you were describing some of these things that we've gone backwards on as we moved out to away from the really dense cities. But one thing I'm thinking about, lifestyle change. We want to live out in the country. We want to live in a suburb. We want a single family home. We want to have a car. And folks talk about personal responsibility around choosing where you live and choosing, the things that you do and how your kids are being raised and things. So that personal responsibility mantra, tell me what you think about that. Is it that simple? And how would you answer somebody saying you just have to take your own personal responsibility for your health and where you live and how your community and what community you choose to live in?
You used a word I hadn't heard anyone hit this hard, and it's really a powerful one. I think an awful lot of Americans feel trapped.
Yeah.
And we've seen a serious decline in the incomes of the lower 50% of our population. In fact, the lowest income 50% of our population has less income than the top 1% of our population. So we've seen a massive transfer of wealth, and not having enough money makes you feel trapped. And my students in public health would talk about the social determinants of health, but I'm going to argue actually the financial determinants of health and the physical determinants, which is your profession, are just as important as the social determinants. And number one, I think anything we can do to get rid of isolation. The city of Lancaster in north of Los Angeles did a lot of work, and the trigger for that, and maybe there's some energizing in this, was sustainability. That they wanted people walking more, they wanted a lower carbon footprint, they wanted solar, et cetera. Very Republican, very conservative town, and yet they did a lot to really improve their downtown, to get people out, to have social venues as well. I was struck by something Chris said, because a town I lived in 30 years ago, we went back for a visit to see some people, and all up and down the street were these banners that said liberty. And you remember when you were 6 years old and your mother said to you, if you want that freedom to do that, you have to take this responsibility. Liberty should not come without responsibility. It's responsibility to yourself, your family, your community, and to a much larger population. I know I sound like an old preacher, but liberty alone is destructive. People end up doing themselves in and other people in if they think they're entitled. We've got a big problem down in Oakland near where I live, which is we have these so-called sideshows where I think kids that are feeling trapped, by the way, too much testosterone makes you stupid, but feeling trapped.
Just side note.
Well, I didn't learn that in pediatrics. Actually, that's why high school and college sports were invented, is to get rid of some of that stuff.
Well, Chris, there goes your school siding stuff.
I can't say more than that. I'll stop. Sorry.
No, don't stop. Keep going. You were saying they had this real problem in Oakland. What's going on?
Oh, well, the side, a big crowd of cars cluster, and then the kids come speeding along, and they're spinning out and doing donuts in the roadway. And it's actually very dangerous for the people and terrible for the people in the neighborhood. The police are a little scared to take it on, one police car at a time, but they've now come up with a much more aggressive strategy. But it's in some ways not really what we ought to be doing in terms of policing. And I'm not being critical. It's not okay to be doing these things.
Yeah.
So Dick, I got to follow up, and I think we're kind of getting into those waters a little bit. The personal responsibility mantra, it's kind of the sort of American, the image of the sort of John Wayne America, right? Like we can do it ourselves, that sort of a thing, which, hey, maybe there's some merit there, but I think it's always good to question some stuff. So sort of similar to that, what do you think in terms of what part of the American dream that we picture with respect specifically to public health, personal health, and this built environment, do you suppose is maybe flawed? In other words, so what is the hope that, for us to change that and make some changes and make those things reality? Where's that linkage between how we perceive this American dream, the results of our health, and then maybe some ways we're getting to maybe change that dream up a little bit?
You can't be healthy in an unhealthy environment. And if you do any family history, you'll quickly discover that you had great grandparents that died of typhoid and diphtheria, et cetera. Sorry.
That's okay.
And the first chlorinated drinking water system in America was in Jersey City. And they found that the infant mortality dropped dramatically just by disinfecting water. Common sense. And you can't have cities with good water supplies. You can't have real cities without good public transportation. And then the things that really improve the quality of our life. You don't want to be eating the food that Upton Sinclair was talking about that came from filthy slaughterhouses and all the rest. We had to have people looking at our food, and we had to have drugs being tested. And none of these things would have been developed, the immunization or else, without community coming together. And frankly, Adolf Hitler would be running the country back in 1950 if we hadn't come together as a country to push back at despotism and tyranny. So there are people smarter than I that can tell you how we get people to care about community, but we also know we're happier in a community.
Yeah, and I think your PC healthy in a healthy place. It goes back to what I said at the beginning about the wildfire stuff and a noticeable decline of my own household's physical activity and ability and willingness to go do that when that's occurring outside. And I don't know that we're fully programmed to watch out for the dietary side of that and adjust accordingly. And so I think that's just a small piece. And we're in a good environment in a place like Boise versus some of the ones you're describing. So tell us a little bit about what you're working on today. What's the next, we've engineered physical activity out of our lives quote from you so many times. What's that next Dick Jackson quote that we're going to be citing in workshops and at conferences?
Don, I was spending my time on a couple of things. One is, back when I was at CDC, by the year 2000, I swore I'd never give another talk without ending with climate change. And I stopped. I don't call it climate change anymore. I call it climate heating. And all the stuff that the meteorologists and the scientists were predicting back in the year 2000, 2001, 2. And I had the refugee group. One of the things I learned from the Refugee and International Health Group is when they came back from disasters, they said, one big thing they said was, what people really need after a disaster is good management. And it wasn't something that came right to mind. And you've all seen the pictures of, overcoats arriving in Haiti after an earthquake, for example, and really having very honest and systems. And you need, maybe your audience doesn't want to hear this, you need good policing when suddenly all the social structures are falling down. And my doctors would come back and say the women were being raped and there was all kinds of crime going on. And this is, with Syria had, with its war, 500,000 refugees arrived in Europe. We're talking with climate heating, not climate heating with as many as 1,000 times that number of refugees. And I'm not just making this up. Look at the United Nations Development Program. They're talking about the disappearance of I didn't even know what the Hindu Kush glaciers are, but it's basically the third pole of the world, all the ice that is melting very rapidly, glaciers slipping down the mountains. And the Ganges and the Brahmaputra are basic rivers. These are huge rivers supplying northern India and Bangladesh, et cetera. If they're dried up a good part of the year, think about what that does to human survival. People will move, they don't have enough to eat and they don't have water. And so we're looking at massive population moves. The only real surprise with the climate data that we've been talking about for 50 years, really, but especially hard in the last 25 years, the only surprise is it's happening faster than we thought. And you're talking about the fires. I know some of it's pine bark beetle, and that's what we've got in the Sierra with a lot of pines dying. Some of it is we probably should have allowed the fires to burn more aggressively in the past. But some of it is if it doesn't rain for years, it's going to burn. So, I think looking at our own home and our own carbon footprint, the other one thing I'm going on too long, but ask me about it, is I've worked very hard to get the National Academy of Medicine to take on climate as an issue. And you go to a bunch of doctors and say, climate's really important. Say, come on, doc, I see 30 patients a day. I can't be dealing with something that's years away and out of my bailiwick. I said, well, no, the medical care system is 17% of the economy of the United States. It's 10% of the carbon footprint of the United States, and it's 10% of the US workforce. So
or you're talking about the ultimate getting upstream, right? I mean,
and you don't have to do it full time. You can spend an hour or two a week advocating. Back to the pissed off mothers. Pissed off doctors are good too. We've got to advocate.
Yeah. So I was thinking about, oh my gosh, I just feel like there's so many things we could talk about. And one of the things I'm thinking about is I understand that you were on PBS telling the story of building healthy places, and that now you're working on your newest work is focusing on children's health. Well, I need a primer, first of all. What's going on with children's health, and then how are we going to fix it?
The Americans tend to, our kids aren't healthy, it's the school's fault. Well, it's
okay.
And Chris sort of said it starts right at home. When I was a young pediatrician, I'm not making this up, I would work in the diabetes clinic. I'd had a clinic one afternoon a week, and I'd see 10, 12 kids. I'd adjust their insulin doses and stuff. I never saw a child with, we called it adult onset diabetes. I'm not exaggerating. 50% of the kids in the diabetes clinic have type 2 adult onset diabetes related to overweight and physical inactivity. So the first step is we've got to make sure that food is better. So I live now in Berkeley. I lived here for a long time. We passed a ordinance that taxed sugar sweetened beverages. Well, you talk about pissing people off. It pissed off the soda industry terribly.
Taking away my right. Putting a sin tax on my Coca-Cola.
So, I mean, you can pay the nickel if you want your Coke. But kids don't, one soft drink a week's fine, but kids don't need it. And it was predicted that all the small mom and pop stores would go out of business because people won't come in buying their soft drinks. Turned out they did just as much sales. People started drinking water and healthier stuff. And it raised $250,000 a year that went to the schools for physical activity, education, school gardens, and other such things. But the industry has now put in a bill in the legislature to ban any other city in California from emulating a successful health intervention as just this one. And by opening schoolyards and a lot of, in Atlanta, all this play areas had cyclone fences around them, and they locked them up so kids couldn't use them the rest of the time. Like, we'd rather have them standing on street corners or outside a fast food joint than playing basketball. So I think those would be a couple of things for our kids. I don't like beating up parents because my own experience is kids are often the leaders in homes. And what I'm going to say is true, by the way. It was kids in many ways that really pushed back the tobacco use in adults coming home and saying, Daddy, it's stupid doing that. It was the focus on children with seatbelts in the beginning that really was the change in our whole acceptance of, and I don't know, you're taking away my liberty because you're making me wear a seatbelt? Yeah, because we're going to have to pay your medical bills forever if you go through the windshield. Yeah. So, we have to start with children. And by the way, this is a big thing. A lot of things we're talking about do take a generation or two. Anytime you you spend generations doing something. The redlining was the cause for decline of the value of homes. Families could not pass along any inherited wealth. It's tough in America if you start out with absolutely nothing. Having a little bit of help from your parents goes a long way. But damn it, having no trees because people had no ability to maintain their neighborhoods and trees, and the cities didn't care because they're mainly minority and Black people in those areas. So there are lots of things we have to do to undo that. And yeah, we've got to plant the trees. So Richmond, California is the poorest city in California, and one of the big efforts is put in the trees. And it's a complicated one. I won't get deeper into it, but you know where I'm going.
Yeah, well, and there's so many things to unpack there. I'm going to hit a couple quick things, and then we're going to transition into something that we call the lightning round. But I'd be remiss if I didn't bring up a couple things. One, I think you'll appreciate that we've been talking about, it's just a simple term that, you know, to borrow with what you just said about smoking and the notion of secondhand smoke. And I know for years, Dawn and I have kind of been talking and getting people to understand, what about this concept of secondhand streets? In other words, what we're designing has a deleterious effect on our communities and societies and individuals in many different ways. And it sort of acts very much like secondhand smoke, but it's this sort of secondhand street concept. So something that I think there's some alignment there, no doubt. The other thing, like you just mentioned, and I'm really going to not pull my string on this one, but man, the way that we design our schools, especially in the growing parts of our country, and these mega parcels that are almost tantamount to the original size of Disneyland, believe it or not, in terms of acreage and where they're located. And it's like, gosh, you know what you just said, it blows me away. How many schools why can we not plant a tree on a school campus? Oh, maintenance. And I'm going, maintenance. You have 25 acres of lawn out there that's requiring how much water, and it's like, geez almighty, but we can't even figure out how to put a tree on a campus. You know,
we got to drive through.
Yeah,
we got to drive through to pick up those kids like it's Taco Bell.
The worst traffic jams in town too.
Yeah.
Well, it's the big box schools create the isolation. You're taking a generation or two reminded me of when we were doing some of the health work back in North Carolina, and everybody was all over the county health rankings, and had a rural county in North Carolina go, what do you mean? We gave $2 million more to our health department last year, and it didn't change our county health ranking from last year. And yeah, we had the same kind of reaction of just hands on the forehead, shaking it. So I think we could do a session just on those stories. So Chris, lightning round question. This is the popcorn effect.
Right. So we can obviously have this conversation for hours and hours, but given how much time we have left, we want to get a chance to know you a little bit more in just reading some of your story and background. Holy cow, what a life you've lived. So we want to touch on some of the fun things for sure in our little lightning round. So we'll pepper you with some fun questions, and I'll start. My curiosity, what's the last concert you saw?
Oh boy. It wasn't a concert. It was the symphony with a full 200-person chorus, and
Love it.
A friend of mine.
You saw the chorus. I'm so proud of you. I'm always in the chorus.
I love it, and I had chills going down my spine as soprano hit the high end of. You can't listen to the Valkyrie if you don't respond to it. So, and I'm very glad, because the San Francisco Symphony and Opera were closed down for a couple of years. And my friends make fun of me. Oh, you like opera? Well, I don't like all opera, but I love Italian opera.
Who doesn't? Oh,
so when you pull up to McDonald's, are you a McMuffin or a McGriddle guy?
You're such a jerk, Don.
You know.
Well, I mean, we all get stuck there. I get stuck eating there, and I hate it. So I'm guessing Dr. Jackson's had the same moment.
I live in California, so I got In-N-Out Burger.
That's right. Thank you.
And my wife demands a garden burger for us. So there it is. But you know what? If you've traveled, I worked a lot in India and elsewhere. It's pretty nice to have a clean place with fast, not healthy, but at least sanitary food.
Predictable food.
Yeah.
I spent many years in the military, and having been in many foreign countries where frankly, you're looking around and kind of the sanitation is suspect. I will admit that, yes, there were times when you saw some golden arches off on the horizon and think, okay, it's dead as hell. I know that, right? And I'll eat that and we'll worry about it the next day. So yeah. Jess, any fun questions?
I want to know, I think everybody's thinking this. Why do doctors have such terrible handwriting?
Well, the big movement now is here anyway. The docs have a scribe with them, and it's often somebody that wants to be as pre-med, and they're writing down the notes, and it's all, the kids are so much faster on the computer. None of us who grew up, by the way, the big movement in surgery now is robotic surgery. And the docs that grew up on computers surgeons can really do it well. And those that are in their 50s and 60s want no part of it.
Yeah.
So, but the other problem is none of the kids know how to do cursive at this point. They all have to use a typewriter screen. So, but
there you go.
So
You know what?
really,
but you know what? I'll say one more thing, Jess, and it goes to something else. When I was in med school, there was a big debate about whether you would tell patients what medications they were on or what disease you had. I'm not making this up. It seems totally bizarre at this point. Nowadays, you almost have too much information about all the drugs and all the things that, what can happen to you.
Yeah.
So the getting people to become more informed, and people are more informed. I mean, you hear average people talk about drugs for rheumatoid arthritis now.
Yeah.
Even imagine years
No
ago.
idea.
So maybe there's an opportunity in your world that people are becoming brighter. And I think what you're doing with this program of taking, egghead stuff and making it really understandable to normal people is a good thing. It's a great thing.
We're
fighting as an egghead.
We're fighting the great fight. We're a bunch of nerddoms over here anyway. So
I have to tell you, when I went to a number of meetings when I first was discovering this, including the local government commission and International Making Cities Livable. I met Elaine Clegg at it, and she invited me in, and I fell in love with Boise. I thought it was a great town. I just didn't like that high-speed road aimed straight at the Capitol. And
that is weird.
Yes.
Hausman would never have allowed that because they could have put a cannon at the end. And
but no, it's City Beautiful.
Most of the urban rehab took a muscle like Hausman to do it. It didn't, or Napoleon. It didn't really happen all the time because of goodwill.
So by the way, at the end of that street, you're met with the very person who you could say, essentially saved this country, and Abraham Lincoln, kind of going, I saw, how many folks did I liberate and save? And there's the greeting in that shotgun street right to the Capitol. So
Lincoln's
we should do a study of state capitals, because Sacramento has more freeways to get the hell out of there. And I think the legislators just wanted to leave all the time because it was 118 there the other day.
It was, but you know what? I really like Sacramento. I'm a real weirdo.
I like Sacramento too.
I think it's cute.
It was terrible 40 years ago.
So
they put in trees, light rail, parks. They've done a good job with it. But
they're doing a great job.
Now they got to tear out the damn roads.
Well,
so here's
working on it.
I've got for you. What really happens in the basement at CDC?
Ooh.
Ah, yes.
In September 11th, I was hiking in Montana at the time, and I didn't have my phone, my beeper didn't go off, and I my buddies ran into a Russian couple hiking. World Trade Center fall down. Whole world, or no airplanes in the air. And I'm thinking, oh man, this is crazy. This can't be true. I had the emergency response under me.
Oh, wow.
So we ran into another couple about an hour later, and we spent the next full day hiking out, got in the car and went back to Atlanta. And I didn't go back to Atlanta. I had to stand at the airport in Denver and keep saying, here's my ID. I need to go back. And they put me on the first plane that I could go back. I got to CDC. The place was basically closed down because there was a threat that it would be under attack, bombing. And they had moved a whole operations center to a remote farm with computers and phones, all done within a day, with the major telephone companies and everybody else coming in. Within 2 months, there was an emergency operations center that looked like NORAD at the basement of CDC. It is not glamorous until people are really jumping. And it's not really glamorous then. It's pretty intense.
Ooh, I'm happy we got that answer and not it's under a non-disclosure agreement or something. That's pretty wild.
All right, totally unrelated. You spent time at UCLA, but you live in Berkeley. So if Cal and UCLA are battling it out, who are you rooting for?
You know, I found Los Angeles very hard to live in. I'll be honest. I tried to do without a car. I took the bus everywhere, but it took an hour to get downtown, and getting to the Berkeley, the Hollywood Bowl was very hard, and other such things. And when you're old, learning a very complicated high-speed city is not easy. I'll be honest. We talked about kids. We didn't talk about the elderly, because a lot of the wealth in this country sits within the elderly. But I had lived in Berkeley for so long, and my kids were here. It was obvious that I had to go home. Now, you asked a very important question. I don't want to have anybody in Berkeley know this, but I still love UCLA.
There it is.
It was the lead for healthy campus at UCLA, and we put in place. This is a real battle. 20 is plenty, and we enforce it on campus.
Yeah. Westwood is interesting, and spent some time with Dr. Brian Cole, if he's still down there, learning about health. Learn about health impact assessment, which is maybe a second guest or second appearance from you later on. I'd love to get into that topic about what the heck happened to HIA and so forth.
I would love to do it.
Yeah. Well, we'll invite you back then, and we'll ask you some other good probing questions and so forth. But Dr. Jackson, this has been an absolute treat for all of us. We can't thank you enough. I know our audience is going to be thrilled to hear everything that you had to say on our episode here today. So thank you for joining us. We absolutely, again, can't thank you enough. And we'll see you again soon, I'm sure. And I thank you for all the hard work that you're continuing to do in leading this country. So thank you.
And I'd just like to say Idaho is lucky to have you.
Well, that's debatable, but we'll ask them. All right, commissioners, can I get a motion to adjourn?
So moved.
Second.
All right. With that, this episode of the Planning Commission podcast comes to a close. We'll see you on the flip side. Thank you all. All right.